Integrated UK Cambridge Centre podcast. In this Integrated Cancer Medicine Research in Focus series, I talk to various ICM members about their research and how it is supported by the vision of the Mark Foundation Institute for Integrated Cancer Medicine. MFICM research uses cutting-edge analytics to maximise the use of diverse high-volume datasets and by capturing cancer heterogeneity in time and space in patients receiving active treatment. Integrated cancer medicine aims to transform the way the world treats cancer by affecting patients along their treatment pathway and ultimately accelerate cures. Join me, Ellie Wolmark, Communications Manager for Integrated Cancer Medicine at the University of Cambridge and the CRUK Cambridge Centre, for part 2 of this series about research into ICM and the groundbreaking techniques that are being brought together to tailor treatment for each individual cancer patient. The second part of this series spreads the net a little wider to highlight not only the work of our various ICM members, but also includes our partners in the form of patients, those within our partner institutions and industry collaborators. You will hear discussions about research and research collaborations, the techniques that are being developed and how they translate to the clinic to affect patient treatments and outcomes, as well as an update on the progress of the Cambridge Cancer Research Hospital. A common thread running through ICM research is that of cutting-edge data integration techniques, how collating and assessing different data streams about a patient can contribute to giving a fuller picture of their profile, as well as the profile of the specific cancer type that they have. The power in integrating data from different perspectives, clinical, genetic, imaging, digital pathology, and even circulating tumour DNA in the blood, gives a greater opportunity to assess treatment or predict outcomes, to stratify patients into different treatments which may be more effective for them, potentially accelerate cure and delay or even prevent relapse. This new paradigm in tailoring treatment according to many variables for each patient is potentially game-changing in the treatment of cancer. The work is supported by the Mark Foundation Institute for Integrated Cancer Medicine. In the first episode of Part 2, ovarian cancer patient Melanie discusses her treatment journey with consultant medical oncologist Ju-Eun An and her participation in the OVO4 translational study and how it changed her treatment. It is fantastic to begin this next batch of episodes with a patient perspective, and it was a privilege to record this podcast with Melanie and Ju-Eun. The second episode features Rebecca Lucy and Lindsay Druitt from the Precision Breast Cancer Institute, discussing their roles as clinical research associates and honorary clinical fellows. They talk about how they coordinate delivery of chemotherapy and targeted therapy in the early breast cancer setting, and how they manage recruitment of patients in the personalised breast cancer programme and the partner and partnering breast cancer clinical trials. It is a very engaging conversation, reflecting on how they work to keep the trials smoothly running and how they act as bridges between the researchers, clinicians and the patients, and ensure that patients across the country have access to the latest research. Later episodes in Part 2 cover the research collaboration within the CRUK Cambridge Centre's Urological Malignancies team, specifically the work of Dr. Sarah Welsh, clinical consultant in the Department of Oncology, and Tom Mitchell, who is clinical scientist fellow at the Wellcome Sanger Institute, as well as consultant urologist at Addenbrooke's Hospital. Both talk about the research and translational work, how it impacts their patients, as well as how they complement and support each other's work in their collaboration, which is helping to determine cancer genetics in renal cancer. The ICM collaboration with GE Healthcare is also highlighted in a later episode, with a very animated and informative discussion with members of the ICM Executive Board, Professors Avis Sala and James Brenton, and Dr. Marayan Crispin-Ortuzar, alongside Ben Newton, who is Global Head of Oncology Solutions at GE. It is fascinating to hear how the partnership with GE was formed, how it is developing, and how it will bring to the clinic some of the amazing research done within the ICM team and enable it to impact patients and to support the clinicians in charge of their care. In the final episode of Part 2, we catch up on the progress of the new Cambridge Cancer Research Hospital in discussion with Dr. Hugo Ford, consultant medical oncologist and the Director of Cancer Services at Addenbrooke's Hospital, Elaine Chapman, lead advisory nurse and co-production lead for the CCRH project, and Professor Jean Abraham, co-leader of ICM, academic honorary consultant in medical oncology and director of the Precision Breast Cancer Institute. It is so interesting to hear their contributions to the project and also what they think it will mean for patients from their 3 different perspectives. It highlights what an exciting project this new hospital is and how it will truly change the patient journey and impact the way we treat, understand and strive to undertake the mission to end death and disease caused by cancer. I hope you're enjoying the series. If you would like further information on ICM, please visit our website www.integratedcancermedicine.org, where you can find details of the ICM vision, all the current research, clinical trials, resources, publications and team information. You can keep up to date with our latest news and events, and you can also sign up for our newsletter. If you would like more information about the work of the CRUK Cambridge Centre, please go to www.crukcambridgecentre.org.uk, or you can connect with us on Twitter using our handle @CRUKCamCentre. Thanks for listening.